Hello guys, this is Trilok. I'm a dietitian. Most people think that diabetes is just about high blood sugar, but that's not the whole story. Some people have high insulin levels, some have low insulin levels, and in some cases the immune system is involved. So how do you know what's happening inside your body? In this video, I'll explain you the most important tests for diabetes and more importantly, what they actually mean. So let's start with the tests that most people already know. Fasting blood sugar. This shows your blood sugar levels after an overnight fast. Post-meal blood sugar. This tells you how your body handles glucose after eating, usually checked 2 hours after a meal. And then we have HbA1c, which gives your 3-month average blood sugar. This is a more stable marker because fasting blood sugar and post-meal blood sugar can change day to day depending on what you eat. Now, these tests are useful, but here is the important point. They show us the result, not the root cause. Because long before your blood sugar starts to rise, your body is already under constant stress. So now let's move on to the next level of tests that help you identify the root cause. In type 2 diabetes, many people with abdominal obesity often have high insulin levels because the body is trying harder to overcome insulin resistance. On the other hand, some people may have lower insulin levels. This can happen due to two common reasons. When there is immune system involvement, where the insulin producing beta cells are attacked and destroyed by the immune system itself, or in long-standing diabetes, where the pancreas becomes exhausted and gradually loses some of its insulin producing cells. These tests reveal what's happening behind the scenes. They help identify the root cause. Fasting insulin. This tells you how much insulin your body is producing at rest. If this is high, it means your body is working harder than normal. Next is HOMA-IR. It is calculated using fasting sugar and fasting insulin and gives an estimate of insulin resistance. Higher values usually mean your body is struggling to respond to insulin. Then we have C-Peptide. This reflects how much insulin your pancreas is actually producing. And a very useful test is the 1-hour stimulated insulin and C-peptide test after a glucose drink. This shows how strongly your pancreas responds. Together, these tests tell you, is your body making too much insulin or is your pancreas starting to struggle? Now, here is a very important situation. You might have normal blood sugar, normal HbA1c, but high fasting insulin. This means your pancreas is working double or even triple just to keep your blood sugar under control. And this stage is called insulin resistance. And if you catch this early, you can actually reverse the condition. Now let's look at the next category. These tests show damage or risk. Microalbumin in urine. This urine test helps detect early kidney stress. Lipid profile. High triglycerides or low HDL can indicate metabolic problems. And very importantly, an ultrasound of the abdomen. This can detect fatty liver. And remember, fatty liver is one of the earliest signs of metabolic dysfunction. Now there is another group of tests which are needed in specific cases. GAD antibodies and islet cell antibodies. These help identify if there is an immune component affecting insulin production. These are especially useful in younger patients or those with unusual diabetes patterns. So to simplify everything, basic tests show the result, advanced tests show the cause, risk tests show the damage. Now the most important question, what should you do? If you're overweight or have a family history of diabetes, don't just rely on blood sugar levels. Check your fasting insulin, check for fatty liver, understand your insulin resistance. Because the earlier you detect the problem, the easier it is to fix and reverse the condition. If you are in your 20s or 30s, not overweight, where insulin resistance is not the problem, and sugar levels are high, check your GAD and islet cell antibodies and meet your doctor. I hope this video helped. Thank you for watching Nutritional Perspective. I'll see you in the next video.